the biggest misconception may be that people if they don't feel the pain, they won't believe that they need treatment. So it's not just if you feel pain. Pain will come in acute phase of an infection. If the infection is in chronic phase, they will not have pain.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Marija Mitic, who comes from a proud family of dentists and developed a passion for dentistry early in life. She is a biologic dentist and diplomat in sleep medicine. She graduated from 2 dental schools, one in Serbia and also in the US, the dental education through the International Dental Program at Loma Linda University in California, where she was recognized for exceptional clinical skills. She has built her career in biological dentistry, which focuses on finding a root cause of oral infection so the body can heal from within. Her commitment to whole body wellness through dentistry led her to become an ASBA diplomat in sleep medicine. She is also the founder and clinical director of Healing Dentistry in Phoenix, Arizona, a practice that also houses a sleep apnea and snoring clinic, as well as dental assistant training school. So, Dr. Marija, welcome and glad to have you here.
Thank you so much. Thank you for having me.
Yeah, so I always want to start off from the very beginning. Like, what got you interested in the medical field? It seems like because your family has that history in dentistry, it seems like that's kind of where it started. Is that correct?
Yes, that's correct. Absolutely. So my mother, grandmother, and my grandfather, they were all dentists. So in Serbia, we started college. We don't have college, so we skip college. We go straight to university. So I didn't really have time to think that much, but I grew up in dental practice and I loved it from beginning. And that's how I went to dental school. I didn't even have a second choice.
So it was almost the path was chosen for you.
Right. It was in my blood, they say. I don't know.
Okay. So now kind of since you went through all this training I mentioned in your introduction, eventually you started the practice that you have right now, Healing Dentistry. What led you to decide to start your own practice? I mean, why not just work for another dentist?
Right. Yes. So I did work. So after the school, I worked for Aspen Dental, but I always was attracted, and especially because my country does take care naturally to so many things, I was always attracted to get more natural approach versus just old traditional dentistry. And luckily today with Instagram and other social media, that's becoming very popular. But I really wanted to concentrate on finding the root cause of the problems, not just do fill and drill, what we call dentistry. So.
Okay. And so now you do biological dentistry. I'm sure a lot of people have not heard of biological dentistry before. In your introduction, there was a little bit of a definition, but how would you explain biological dentistry and how it differs from traditional dentistry?
Yes. So biological dentistry starts with examination. We do throughout comprehensive exam, and we like to do a CT scan to review the jaw and the teeth and airways to make sure to see if any leftover infections or any developing infections are there so we can take care of them. So the main purpose of biological dentistry is connecting, not just concentrating on mouth, but connecting mouth with the body. Besides the throat examination, we use ozone for almost all procedures, and ozone is naturally antimicrobial, antiviral, and antifungal. We also do use clean materials, so free of plastic and chemicals. We use ceramic, we don't use any metal, and we connect dentistry with airways, so it's airway-driven dentistry.
Okay. So there's a lot I want to unpack in there. It seems like for people who are aware of, I guess you call it the biohacking community, the industry, it seems like this is kind of an extension of that, where you want to try and remove the plastics, you want to remove anything like harmful materials, and you're looking kind of more at the overall, how's everything connected to the entire body. Would you say that that's accurate?
Yes, that's accurate. So we are trying to connect everything, get rid of the toxins, infections, try to make people feel better. And actually, almost always we have huge improvements. So patient with autoimmune problems, they will heal. Or I had some extreme case of kidney failure that we helped the patient not have kidney failure. It was all because of tooth infection. So it's really rewarding.
Okay. And I'm sure that you've seen situations where, and you kind of mentioned that with the kidney failure part, but people are suffering from a certain pain or ongoing condition that maybe like is in their back or their hip or their knee or something, but then you fix it in the mouth and then it fixes it in the other areas of the body. I'm sure you've seen
Yes.
that, which is kind of,
Yes.
I guess, blows my mind, but it makes sense that you fix the health of your mouth and it'll flow down to the rest of the body.
Yes, so everything starts with mouth. And what we like to explain to patients is because either people believe into biological dentistry or they're very new to it. So we tell them that we have main meridians of our body, and teeth are connected, specific teeth to specific meridians. And once this infection is cleared, it's affecting other organs in that meridian. So that's why we see healing. That's the main
Okay.
point.
Okay. And you mentioned some of the things that you do within biological dentistry. So I want to kind of go deeper into each one of these. Like, let's start with the ceramic implants.
Mhm.
Actually, I don't even know what regular implants are made of. So I guess can we start there? Like, what are regular implants made of, and why is ceramic better?
Yes. So people think ceramic implants first, that they're something new. They're not. These companies exist also more than 20, 30 years. Metal implants, as you mentioned, are made from nickel titanium. And they're not bad, I would say. I placed metal implants in past, but there are some people sensitive to nickel and titanium. Some people have autoimmune problems. They can't tolerate any metal. But besides just sensitivity and different health issues, these ceramic implants are very biocompatible to our body. What it means is that we used to believe that gold is the best material for teeth, but now we know it's ceramic or zirconia, which is almost the same. So they're very biocompatible, so our body accept them very good, gums and jawbone, and people don't have any problems. So there's more about zirconia implants, but I guess we're going to talk about in a second.
Okay. And when it comes to the ceramic, I mean, what's the I guess the longevity, the strength, the durability of it compared to metal? Because I think like, oh, ceramic, like that's what I have my pottery made out of it. It's not that strong compared to metal. So how strong are these some ceramic?
They they're super strong, and these companies that make these ceramic and zirconia implants, they're guarantee and they have been through testing and they're super strong. I personally have two ceramic implants. They are very strong. They go under all the testing as metal, and they're actually guarantee like a lifetime warranty that they won't break. If
Mhm.
anything happens, if essentially, but I've never had a case that anything happened with ceramic implants.
Okay. And is there anything else around the ceramic implants that we haven't talked about already that's important for people to know?
Right. So ceramic implants are completely metal free. The brand that at least I use, I don't believe there's any more in the market. They have metal screw. It used to be in the past, but they're like not even the screw is metal. So the brands that we use is Swiss Dental Solutions and Sierra Root, and they're completely metal free. So there's no any corrosion or anything else. They're nice and aesthetic. They're biocompatible. They adapt very well and heal with gums and jawbone, and they don't have any allergy reactions, any autoimmune. They don't trigger your immune system to do anything. So actually, we have to kind of cause inflammation to trigger immune system to heal it, because they're so biocompatible. They won't trigger any problem, any inflammation.
Wow. Okay. That's incredible with this type of implants. I didn't even know this is out there. Okay. Now, the next I want to go into is the mercury filling removal. I
Mhm.
think that most people know that mercury is probably not something that is healthy for you, and why they put it in your mouth kind of doesn't make sense to me. But
Yes.
I guess what do you do in that sense of you removing mercury fillings, and I guess what do you put in there instead?
Yeah, so let me just spend just a minute to tell you how I actually got into mercury removal. When my son was very little, he was chronically congested, and that's on my website. That's my life story, basically. When people ask me, that's what mainly triggered me to transition from all dentistry to biological dentistry. He was congested, and the pediatricians will tell me, like, oh, you're exaggerating, you're a doctor, it's just a kid. But he was little, he was under two. Asthma, congestion, inflammation. He couldn't breathe through the nose no matter what I do. So I took him to a holistic doctor or naturopathic doctor, and she tested him and she said, oh, he has extreme amount of mercury. And mercury, as we all know, it's the most toxic metal on the planet. It contains, the amalgam fillings contain 55% mercury, which is extremely high. It's not safe even in 1%, but they contain 55. So she gave him a detox. So we were talking and I told her, like, I'm a dentist. I work with amalgams. I mean, I don't place them, I remove them, but they still make the aerosol and they get in air. When we drill on teeth, when we chew, when we brush our teeth and have amalgams, they will always be in the air, in the aerosol. So it's not just that we are absorbing that mercury once we have them, that moment in dental chair, but throughout the lifetime, we constantly are absorbing the mercury. So long story short, my son went through detox. In just a week, he completely healed. And I was shocked too. I was like, dental school doesn't tell you this. I mean, dental school gives you basic knowledge, but I wasn't even aware how much mercury is toxic until he had problem. But I was the one taking it home through me, and I was pregnant working. He would get all the mercury. So it's not just we have them. Actually, they're extremely toxic. So when we remove them, I'm SMART certified doctor through IAOMT, and there is a special protocol that we follow to remove these fillings. Patient, it's fully isolated on the oxygen. My staff and me, we're also isolated because we don't want to inhale it. Patient takes the charcoal pill, and we also give them selenium for afterwards, and some advices how to fully detox. And then we place the rubber down, which is that rubber thing in the mouth, and 3 sections on the air purifier and additional section, just not to make it in air. And then we don't drill them, we cut them out. So we try to almost not touch them, but remove them in pieces. And rinse it well with ozonated water, and then isolate the tooth, clean it with laser, and then place bond in your filling, so not to leave any traces of mercury.
Oh, man, that's quite the procedure.
It is procedure.
Wow. Okay. And when people come to you for this, is it something that they're already experiencing health issues and they have to get it out, or more you see it that people have it, they're not experiencing any health issues, but they know it's probably just a matter of time?
So most of the people they come with already usually brain fog, loss of memory, but we also work with Alzheimer organization, and they send us patients because unfortunately Alzheimer does not have a cure, but we can do many things to improve patients' life. Once we remove mercury fillings, these patients actually improve a lot. They will have other heart, kidney problems. They will come with memory loss or any neuro symptoms or congestion, chronic congestion and respiratory problems, as my son had a lot. But we will see a variety of symptoms as far as early onset of Alzheimer's disease.
Okay. Wow. Okay, so get mercury out and do what you have to do in a safe fashion.
If something, that's my first recommendation. Even if you're not interested in biological dentistry, at least get the mercury out. Yes.
Okay. Now I want to move on to the ozone and laser treatment. You use the photon laser. So for ozone, what do you use ozone for? Like, I've heard about it in biological dentistry, but I have no idea like why you use it. What's the purpose? Is it replacing anything that regular dentists would use? So what's the purpose of it?
So when I was regular dentist, since you mentioned, we will drill the filling, the cavity, and fill it without, kind of rinse it out with water and fill it. So you're bonding. When you put the tooth under the microscope, it's proven that it's not clean. So you're bonding a new filling over dirty surface. So for biological doctors and maybe some general dentists to do it, we first clean. When we drill and do cleanings, we use ozonated water. When we, before we place the filling, we clean the tooth surface with ozone laser and solution called Gluma. Well, some patients, because Gluma, it somewhat has a lot of ingredients. If patients opt out of Gluma, it's not a problem at all. The laser cleans and seals the surface as well, but I like to be very cautious not to bond over the dirt. So Gluma, based on research, show there's nothing that can be under, no germs, no debris. It's clear to the surface for new bonding. So we use ozone for like drilling and clean all the cleanings. When you have this teeth cleaning with lots of water, we use ozonated water. Every chair has ozonated water. But besides just the ozone, we can directly dispense ozone in extraction sites when I place implants, when I have an infection. A lot of my patients don't like to take antibiotics. So if I remove the tooth and I have to clean the infection, I can place ozone and it fully cleans 100% any bacteria, virus, and fungus in there growing. When we do cavitations, we use ozone 100%. So ozone, it's medical grade oxygen turned into molecule instead of O2, it's O3 through the medical grade ozonated unit. So also, we can inject ozone for infections, the sinus infections. So instead of getting on antibiotics, which sometimes we can avoid, but when people have some chronic inflammation or sinus infection, we can inject ozone. What's good about ozone is that ozone travels to your body. So even if your knee is not the best or you have urinary tract infection, the ozone will, even if injected in your mouth, because it's oxygen, it goes anywhere you need it in your body. I love that about ozone.
Okay. So ozone seems like it helps with, I guess, sanitation is, I can't think of a better word, but like basically like it's the highest level of sanitation. It's
Yes.
also isn't going to negatively affect the body because it's really just oxygen.
Yes. So the only what we are careful about ozone is that we can inhale it. And that's why we use additional suctions when we do any ozone treatment. But even if it's inhaled, it's not end of the world. We have vitamin C and full pure oxygen we can put patient on. It's a little coughing from ozone, so the symptoms clear if in like minutes.
Okay. Now, when it comes to the sleep medicine part of what you do, I mean, it makes sense with working on the mouth, sleep, the airways. You mentioned also the airway focused dentistry.
Mhm.
What do you mean by airway focused dentistry, particularly when it applies to sleep?
So it's not just enough. Let's say patients go through Invisalign. Everybody know Invisalign treatment. Sometimes it's not enough. Invisalign can move the teeth beautifully, or any clear aligners. But what we look, we take CT scan and we look the airways volume, and then we see if this patient is affected or not, and what we have to do. We also do a sleep test to see your sleep hygiene, because we can only guess how people sleep at home. So when we connect airways with dentistry, we have to expand arches. We can take care of any TMJ pain. A lot of people have TMJ pain, headaches, migraines. We are one, right? So if the skull is not aligned with our skeleton, then we will have different issues, right? TMJ pain, headaches, migraines. So we can align actually the skull with the first vertebra, and on that way we can help patients drain the lymph and get relief of the symptoms.
Okay. Could you give an example of kind of how you would go about doing that? Because when I think about dentistry, I think that, oh, you're making sure my teeth are healthy and that maybe they're straight and that they're not crowding. But
Right.
then when I try and connect that in my mind to sleeping, it's like how does that work? Like what can you do from a dentistry standpoint to make sure that I'm not suffering from sleep apnea or I'm having sleep issues or when it comes to breathing?
Right. So we have variety of appliances that we can make. Some appliances expand, some appliances align your body, your eyes and your body, your skull, your bones of the skull with your skeleton. Some appliances are just there to advance your jaw forward to keep it not closing airways when we fall asleep, because naturally when we fall asleep, our jaw slides back. So just to keep it forward so we can sleep better, to keep the airways open. So we have a variety of appliances that we can customize and make for patients to help them depends on symptoms.
Okay, got it. Now, Dr. Maria, when it comes to all these things, like the biological dentistry, the airway focused dentistry, what would you say is some of the most common misconceptions or myths that you hear from your patients when it comes to these treatments that you provide?
Well, people hardly believe that if we have infection, is still in this time, people hardly believe that infection is not dangerous. People will tell me like, oh, like it's a root. Don't pull it. I use it for chewing, or it's not infected. I don't have any pain. So the biggest misconception may be that people don't, if they don't feel the pain, they won't believe that they need treatment. So it's not just if you feel pain. Pain will come in acute phase of an infection. If the infection is in chronic phase, they will not have pain. So I think that's one of the biggest, the pain. But it's not just the pain. Infection can still be there, and we have to find it with the CT scan in order to help.
Okay. And let's say that somebody is interested in this, looking more from the biological. Actually, let me take a step back there first. Do you think that everyone should follow or look for a biological dentist, or do you think it's really just going to be for people like specific people, like if they're more sensitive to metals, then they should go see a biological, or only in certain situations you should go to a biological dentist. Otherwise, you're okay going to a regular dentist.
Well, I wish dentistry one day develops in fully biological, honestly, because I see so much improvement with my patients since we switched, which is 12 years ago. Um, we don't, people will say just, oh, my gums are just bleeding. They're not just bleeding, right? Bleeding is not normal, right? So if we just let it just bleed, then we're keeping inflammation and infection there. So I wish one day we will all transition to be biological dentists. It's nothing weird about it. There's nothing that we do. It's not a voodoo or anything, but it's just that I think we use better materials. And by the way, in Europe, because I'm from Europe, amalgam is banned since I was in my dental school there. I never placed amalgam there. When I came here to get requirements, we had to place amalgam on a typodont. So I don't know why here some materials are allowed when they're very toxic. So I wouldn't place personal in my body anything that's very toxic. Like, why would I do it? So I think people, luckily with social media and everything, people are getting educated. I think companies should stop making these materials that they're very toxic, and we all just use clean. So call it biological or not. I just wish people take care of their health on the right way to eat clean and be careful what you put in your mouth, because in the end of the day, that little pill, nitroglycerin, if somebody has a heart attack, it's working in 30 seconds if they place it under the tongue, right? So imagine when we are brushing teeth with a toothpaste that has chemicals and we are brushing for a minute. So in a whole minute, you're absorbing these chemicals. If that pill can work in 30 seconds and save the life, why would I brush with a toothpaste that it's not healthy or put some material that's going to stay there my whole life fulfilling, right? So I would say I would personally love if world changes to fully biological. It's not myth at all. It's really helping people live better.
Okay. And with that in mind, you mentioned about the toothpaste, like what are some, I guess, tips you can give to the average person of what they can maybe think about or what they can potentially change in their dental care, like the things that they can do like day in and day out, that would help them live a healthier life? Like you talked about the toothpaste, like is there a certain type of toothpaste that they should look for or avoid? I know like the regular dentist just like, okay, brush every day and then floss every day.
Right.
But like aside
Exactly.
from that, like that's the only thing I really know about like your regular dental upkeep, but like what would you recommend?
I would recommend make sure you read ingredients. You don't need all that written on the toothpaste. Choose wisely. Use toothbrushes with natural hair versus plastic, because we are eating plastic. The world changed so much since my grandparents were young until today. Like they will eat from porcelain, we eat from paper and plastic. How
Mhm.
many of us drink coffee from a paper cup? When my staff brings coffee or energy drinks, I throw them away. I tell girls like, you're gonna spend money, I'm gonna throw it away. Like, why we would do that? Just choose wisely what you're eating, and from what you're eating, you don't need extra plastic. So read the labels. The toothbrush should be from natural hair, the floss as well. When we go for holistic meetings, they do research. Some companies they do research. The toothbrush, most of them are made from plastic, and flosses too. So something that it's like natural hair, beeswax, and the toothpaste that doesn't have all these unnecessary ingredients that they're toxic.
Okay. Great advice on that one. So then let's say that somebody is looking for a biological dentist. They've never done this before. How would you, I guess, what advice would you give to them to figure out who's the best biological dentist to go to? Like, what are some of the things that they should look for?
Well, maybe go on the website and see there's so many biological trainings. Most of them, still, it's very small community, and we see each other at conferences and holistic meetings. See on their website if they're using a proper technique, what's recommended, if they are using ozone, if they're using a laser, if they're using anything that really helps, and what's their mission. So I think that's like the website and the reviews, and just call the office and see how they do it, what techniques they're using. Luckily, Google has everything, so maybe research about it, what specifically you need, and try it. I mean, give it a try. And if you don't like it, that's okay. I mean, it's not that we're gonna like everyone and everything, but try.
Okay. And I'm sure that throughout your experience, you've seen some maybe challenging cases, tough cases, or memorable cases. Is there maybe one story that comes to mind? I remember you mentioned one already of like someone who had I think kidney issues, and you
Mhm.
fixed the mouth, and then the kidney issues went away. But do you have like another story like that that you can share of one of those cases and how you were able to get them a great result in the end?
Of course, we have many stories. So that for kidneys that I said, this because we can't say a lot because of the HIPAA, but gentleman came because his holistic doctor just didn't know. Basically, traditional medicine did not help him. They just told him you have kidney failure, and he was in shock. Like, I eat healthy, I live healthy. How? So when people are desperate that traditional medicine doesn't help, they seek help in holistic world usually. So he went to naturopath, and they told him, they checked all, and the blood showed the kidney failure and examination. So they said try with the dentist too, because they're also a provider and everything starts from mouth. Patient came, we did CT scan. He wasn't even aware he has two cysts around the teeth. We took both teeth out. One had leftover root canal, and that's very big in holistic world that we take out root canal teeth. We took both. We placed ceramic implants, cleaned it with ozone and laser, and in just 3 weeks later, patient did not have kidney failure anymore. Everything just healed. That was the most amazing case because it happened so quickly. I wasn't sure it's going to happen that quickly. Patient didn't expect to happen that quickly. People come with approach like, okay, they told me I'm done, I would like to see anything I can do to help. So people are very understanding, and the healing, it's a process. If it happens fast, I tell them, then that's great. But if something else we have to include, we have to be patient, because if that accumulation of something, it's causing immune system to trigger and cause a problem, then we have to be patient and see what else we have to do besides dentistry. We work with all naturopathic doctors, and we talk between to see what else supplements we can include so people can be better. So that was one of the most amazing cases, because in 3 weeks from kidney failure to nothing, it was amazing.
Wow, that's an incredible story. So, where do you think the future of biological dentistry is going?
I think we are on a very good path, and people are waking up and people are calling every day. So I built my practice on biological dentistry. So even if I took over the practice from traditional dentistry doctor. So even old patients are accepting. 99% of people are accepting and liking the idea, because once you explain something nicely to people why we would like to do that, people are happy to do it. Everybody wants to live better. Nobody wants to develop any problems and diseases later in life. So I think we're on a very good track as long as we explain people good. And I'm trying also with social media to give a video so people can listen first before they really come and commit to it.
Hmm. And with the future in mind, what is the vision you have for your practice?
Well, since last year, so many nice events happened. I'm becoming ambassador for the ceramic implants, and I'm also in a training to become the KOL, which is key opinion leader for the laser. So we are starting with a lots of lectures. I like educating people on biological dentistry and how we do it. It's really my pleasure to show that these procedures are really successful. So I'm happy about the lecture portion we are adding. I'm happy for all my patients that are healing. And that's why I came up with the name Healing Dentistry, because I really wanted them to feel better like my son did. And it's something silly as like amalgam fillings can make patients feel extremely better. I'm here for it.
Wow. Well, it's a very good vision you have.
Thank
So,
you.
Dr. Mia, I do have one last question for you, but before I ask it, I do want to point people to your website at healingdentistry.com.
Thank you.
Now, last question for you. What does beauty mean to you?
Beauty means healthy skin and healthy body. And I'm very big on supplements and hydrogen water. So I don't believe so much in products that are gonna make your skin glow if you don't glow on inside. So I'm 44. It's not a secret. I don't have any facelift or anything, but if you eat healthy and hydrate your body in a proper way with hydrogen water, then skin is the biggest organ, then you can radiate from inside. So beauty is the very good way of living and drinking and paying attention to food, supplements, nutrition, to get good nutrition for your body so you can be beautiful.
Okay. Well, there you have it. Dr. Maria sharing her expertise. So, Doctor, where can people contact you in your practice?
By phone or email, or also social media. So anyway, it's good. My girls are really good in responding. So we have 2 phone numbers because we have dental office and sleep apnea clinic. Any number is great. We try to return the phone call really, and I think we are very good about it in 24 hours. So via phone or via email, social media.
Okay. Well, this is great. Dr. Maria, thank you for coming on and thank you for sharing your expertise in this, I don't want to say new, but I think it's a area that people just don't know a lot about.
Yes, thank you for inviting me. My pleasure. Thank you so much.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.